Hi friends, it's me Annie, your friendly health coach. Welcome to my channel. In today's video I have something really exciting in store for you. We are going to dive into diabetes, the silent killer, and I can't wait to share with you all the important information you want to know about diabetes. Whether you are a long-time subscriber or you just stumbled upon my channel, I want to thank you for your support and also for joining me on this wonderful journey. This channel is designed to educate and inform people about their physical, their mental, emotional, and social well-being. So you see, I have a lot of goodies in store for you. So let us get started. Did you know that diabetes is one of the top 10 causes of death globally? We call it the silent killer because by the time diabetes is diagnosed, it may be too late. Over time, diabetes can damage blood vessels in the heart, your eyes, kidneys, and nerves. People with diabetes, they have a higher risk of health problems, including heart attack, stroke, and kidney failure. Diabetes is a chronic disease that occurs either when your pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. If you have diabetes, your body does not produce enough or any insulin or does not use the insulin properly. The most common types of diabetes are we have the type 1 and we have the type 2 and we also have the gestational diabetes. Now let me talk about the type 1 diabetes. If you have type 1 diabetes, your body produces little or no insulin and your immune system attacks and destroys the cells in your pancreas that produce insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can occur at any age. People with type 1 diabetes, they need to take insulin every day to stay alive. Type 1 diabetes occurs when your immune system, the body system for fighting infection, attacks and destroys the insulin producing the beta cells of the pancreas. Scientists believe that type 1 diabetes is caused by genes and environmental factors such as viruses that might trigger the disease. The type 2 is the type 2 diabetes. If you have type 2 diabetes, the cells in your body do not use insulin properly. The pancreas produces insulin, but not enough insulin to keep your blood sugar levels in the normal range. Type 2 diabetes is the most common form of diabetes. You are more likely to develop type 2 diabetes if you have risk factors such as being overweight or obese, and if the disease runs in your family. You can help delay or prevent type 2 diabetes by knowing the risk factors and taking steps towards a healthier lifestyle, such as losing weight or preventing weight gain. My dear friends, just watch your diet and eat well. Although many of the symptoms of type 1 and type 2 diabetes are similar, they manifest themselves in very different ways. Many people with type 2 diabetes have no symptoms for many years, and their symptoms often develop slowly over a long period of time. Symptoms for type 2 diabetes can be easier to miss because they appear more slowly and you may not notice any symptoms at all. If you or your child have the following symptoms of diabetes, let your healthcare provider know as soon as possible. For example, if you have the urgent need to pee more than usual, your vision becomes a blur, you always feel very thirsty, you feel exhausted all the time. Another symptom is you are losing weight even though you are eating more. If you have dark rashes on your neck or in your armpit, please consult your doctor. This may be a sign that your body is becoming resistant to insulin. And also bruises that are slow to heal. And also you often get a lot of infections. Let me emphasize that if you have one or two other symptoms that I just talked about, this does not mean that you have diabetes. Please don't go back and Google your symptoms, because Google will always give you what you want to see or hear. If you're experiencing any of those symptoms or unsure of what is going on in your body, please talk to your doctor or go to the hospital for tests to rule out any form of uncertainty. There is a saying that prevention is always better than cure. People with diabetes have a higher risk of health problems such as heart attack, stroke, and kidney failure, and you can permanently lose your vision due to damage to the blood vessels in the eyes. Many people with diabetes develop problems with their feet also due to nerve damage and poor circulation. This can lead to foot ulcers and can result in amputation. So you see why you need to take this seriously. Let me also say this. Being diagnosed with type 1 diabetes is a life-changing event. trust me. But that does not mean you cannot live a happy and healthy life. People with type 1 diabetes need insulin injections to survive. You can live a long and healthy life if you have a very strong support system and manage the disease together with your diabetes care team. You cannot do this alone, trust me. You need a diabetes team to help you. The type 2 diabetes is often preventable. Early diagnosis is important to prevent the worst effects of type 2 diabetes. The best way to detect diabetes early is through regular screenings and blood tests with a healthcare provider, as I mentioned earlier. You may be wondering how to prevent type 2 diabetes. Lifestyle changes, of course, are the best way to prevent or delay the onset of type 2 diabetes. To prevent type 2 diabetes and its complications, you should achieve and maintain a healthy body weight. Lose extra weight. Losing weight reduces the risk. It actually reduces the risk of diabetes. Stay physically active and get at least 30 minutes of moderate exercise every day. If you're unable to exercise for health reasons, walking briskly for 30 minutes every day would certainly be better than doing nothing at all. Eat a healthy diet and eat healthy fat. Watch what you eat. Quit smoking. According to the U.S. Food and Drug Administration, smoking cigarettes increases your risk of developing type 2 diabetes and make you eat and even make it more difficult to manage diabetes. One of the most important ways to manage diabetes is to adopt a healthy lifestyle. Additional medical care may also be needed to treat the effects of diabetes. Food care to treat ulcers, screening and treatment of kidney disease, and eye examinations to detect abnormality. I've uploaded another video that deals with a different type of diabetes, gestational diabetes, of course. Please watch my next video to get all the important information about it. If anything is unclear to you, you can always contact me via my Facebook Messenger or leave a comment below. If you have any questions or comments, please leave them below. If you like this video, please remember to like or follow my page and share it with with even your friends, not some, but share it with all your friends. Thank you very much and see you soon. Thank you.